Do you feel that the corners of your mouth make your face look bitter in a way that does not represent who you are? Today I'm going to show you a simple and effective 5-minute exercise to work on this area step by step and teach you how to do it correctly to achieve the best results. Before we dive in, take a moment to subscribe this channel. Let's start with something important. If those lines around your mouth are becoming more and more visible, it's important to understand that they do not appear by chance. In fact, behind this change, there are two muscles that directly influence the position of your face. The first is called the platysma. It is a broad muscle that extends across the entire front part of the neck and is closely connected to the jaw muscles. Over the years, and especially due to the tension we accumulate day after day, this muscle can remain excessively tight for long periods. The result? It begins to exert a constant pull that drags the facial tissues downward, contributing to a more tired and aged appearance. However, there is another muscle that also plays a key role in this process. It is known as the Depressor anguli oris muscle. Its natural function is very easy to understand. It is responsible for pulling the corners of the lips downward. And here is the problem. When this muscle remains continuously activated, it keeps performing that same movement over and over again. As a result, the corners of the mouth gradually begin to descend. After years of repeating that pattern, that expression ends up becoming a permanent feature of the face. Therefore, if you are looking for a real solution, you should know something important. The problem does not originate solely on the surface of the skin. Because of this, a cream alone cannot correct the main cause. What is truly effective is reducing the accumulated tension in these muscles and reactivating those that help support and lift the facial tissues. And that is exactly what we are going to focus on next. First, we are going to relax and lengthen the muscles that are pushing the facial tissues downward. Then, we will activate and strengthen those whose function is to lift them. This order is not a minor detail. In fact, if you try to strengthen before releasing the tension, the results will be much more limited. Before continuing, check something quickly. Also, make sure your hands are perfectly clean because we are going to work directly on the skin and we want to avoid any type of contamination or irritation. Remember to pause the video every time you are going to perform an exercise so that you can do it calmly and follow each step correctly. Now let's begin with the first technique. Not only are we going to release the platysma, but we will also take advantage of the same movement to stretch the Depressor anguli oris muscle. In other words, we will work on two of the main causes of the problem at the same time. Let's go step by step. Place both open hands on the lower part of your neck, right above the collarbone area, with your fingers pointing toward your shoulders. Now create a very gentle smile. This is not about smiling excessively, but about creating a light and natural expression. And why do we do this? Because when we smile, we activate the muscles that lift the corners of the mouth. That is, the antagonists of the muscle that pulls them downward. Thanks to this, the stretch becomes much more effective and the muscular work is enhanced. Maintaining that slight smile, place your tongue against the roof of your mouth, pressing it gently against the upper part of your mouth. Next, slightly lift your chin toward the ceiling, just a few degrees. There is no need to force the movement or excessively arch your neck. Hold the position while slowly counting to 15. Very good. Now relax. Did you notice the stretching sensation in the front part of your neck and around the corners of your mouth? That is exactly the area we are trying to work on. Now we will repeat the same procedure, focusing on one side. Gently turn your head to the left and perform each step exactly the same way again. The slight smile, the tongue resting against the roof of the mouth, and a small lift of the chin. Perfect. You are doing it correctly. Now we repeat exactly the same thing toward the right side. Perfect. Exercise completed. And notice something interesting. How long did it take you to perform it? Barely 45 seconds. 15 seconds facing forward, 15 to one side, and 15 to the other. It seems like very little, but this is where many people make a mistake. This exercise is not designed to be done once in a while. It must become a daily habit. Yes, every single day. The reason? It's very simple. The tensions and poor postures that contribute to this problem also occur every day. If you spend several hours looking at your phone, working in front of a screen, or keeping your neck in improper positions, your body is constantly repeating those patterns. Therefore, the correction also needs to be repeated with the same frequency. The platysma is a truly unique muscle. In fact, it is one of the few muscles in the human body that does not attach directly to any bone. It originates in the upper chest region and extends upward until it connects with the skin and various facial muscles. And why is this so relevant? Because when this muscle remains tense, it not only exerts force on other muscular structures, but it also pulls directly on the skin. In addition, it is part of a continuous network of muscles and connective tissue that runs through the face and neck as if it were a single integrated structure. This means that the effects of releasing the platysma go far beyond the area around the mouth. When this tension decreases, the entire facial system can benefit. The cheeks may appear more rested, the facial contour may look more defined, and in some cases, even the area beneath the eyes may present a more relaxed and harmonious appearance. That is why I want you to remember something important. Even though this is the first exercise in the routine, it does not mean that it is the simplest or the least relevant. In fact, if I had to choose just one technique from the entire sequence, I would probably choose this one, because before trying to lift the tissues, you first have to eliminate the forces that are pulling them downward. So promise me something. Do not skip this step. It is the foundation upon which we will build everything else. Before continuing, I want to know who is still truly committed. Write the phrase, "I'm still here," in the comments if you have made it this far in the video. Good. Now we are going to work much more specifically on one of the muscles that most influences the appearance of a downturned mouth, the depressor anguli oris muscle. Although it is a small muscle, its visual impact can be enormous. It is located just below the corners of the lips and has a very clear function, pulling them downward. And here is a detail that few people know. This muscle is constantly activated throughout the day. Every time you express worry, dissatisfaction, fatigue, or sadness, it participates in that movement. Over the years, that repetitive activity can cause it to remain partially contracted even when your face is at rest. As a result, the expression becomes increasingly pronounced. That is why before trying to strengthen other areas, we need to reduce that accumulated tension. We are going to begin with a muscle release massage. With clean hands, place your index and middle fingers just below the corners of the lips in the area where you notice the greatest firmness or muscular density. Now apply comfortable but firm pressure. It should not hurt, although you may notice some sensitivity. From that point, perform upward movements as if you were gently trying to guide the tissue toward the cheekbones. Do it slowly. If you notice slight discomfort or a sensation of tension, do not worry. In fact, it is often a sign that the muscle has been accumulating stiffness for a long time. We will begin on the right side. Maintain the massage for 30 seconds. Very good. Now we repeat exactly the same thing on the left side. While you perform the second side, pay attention to something interesting. Many people notice that one side of the face feels stiffer than the other. Some even observe that one corner of the mouth appears more relaxed after working on only one side. If this happens to you, it is not a coincidence. It is fairly clear evidence that muscular tension is not always distributed evenly. Now we are going to perform a small assessment. Try to gently grasp the skin located beneath the corner of your mouth using your fingers. Can you lift that tissue easily? If the answer is yes, excellent. But if you notice that the skin feels stiff, attached, or has limited mobility, that may indicate that there is accumulated tension in the superficial tissues of that region. And this is where a very important element comes into play: the fascia. The fascia is a network of connective tissue that surrounds muscles, tendons, and other bodily structures. When it loses mobility or becomes more rigid, it can limit the natural movement of the tissues and affect the overall appearance of the face. That is why we are going to perform a very simple myofascial release technique. Using your thumb and index finger, begin performing small, gentle, continuous pinching movements. This is not about squeezing hard, but about mobilizing the tissue. Work throughout the entire area between the corner of the mouth and the chin. Keep your lips relaxed throughout the entire process. Avoid pressing them together or creating unnecessary tension. Perform this technique for 30 seconds on one side and then 30 seconds on the other. With consistent practice, many people notice that this area begins to feel more flexible. The skin gains greater mobility and the tissues respond better to the exercises that follow. That gradual change is a positive sign of adaptation. Let's begin. Perfect. Now switch to the other side. Remember something important. Consistency is usually much more important than intensity. When this type of stimulus is applied regularly, the facial tissues tend to respond very favorably over the course of the weeks. And now we are going to move on to the next technique. For this exercise, we will need to apply a little more moisturizer to the jawline and the lower part of the face. Do it now. The goal is to allow the fingers to glide comfortably without creating excessive friction on the skin. What we are going to perform next is a massage aimed at improving drainage in the area and promoting a more defined jawline. You may be wondering what this has to do with marionette lines and downturned corners of the mouth. The answer is simple. In many people, there is not only muscular tension, fluid can also accumulate in the tissues, and there can be a progressive loss of definition in the lower part of the face. When this happens, the jawline appears less defined and the corners of the mouth may look visually heavier. That is why we are going to use a sweeping movement that follows the natural drainage pathways of this region. Place your index and middle fingers in a hook-like shape. Position them firmly near the corner of your mouth. From there, slide your fingers upward and backward, following a line that ends near the ear. The movement should be continuous and even. Do not make abrupt or interrupted movements. Imagine that you are gently guiding the tissues in that direction. We are going to complete 15 repetitions on one side. Excellent. Now perform the same 15 repetitions on the opposite side. Perfect. You are doing very well. Now repeat exactly the same movement on the opposite side. Perfect. Remember to subscribe to the channel and activate the notification bell to receive more videos like this. Now pause for a moment and pay attention to what you feel. Do you notice the area feeling warmer or more active than it did a few minutes ago? That is a good sign. It means that local circulation has increased and that the tissues are receiving more oxygen and nutrients. That is precisely one of the goals of this work, to stimulate areas that often remain tense and inactive for years. Before moving on to the final exercise, I want to share a reflection with you that I consider especially important and that is rarely mentioned when talking about facial exercises. The appearance of the face does not depend solely on age. It also reflects the patterns we have repeated throughout much of our lives. Think about it for a moment. Every gesture you perform formed thousands of times, trained certain muscles. Expressions of concern, periods of stress, difficult moments, or even certain postural habits gradually left their mark on the way your face rests. That is why many people look in the mirror and perceive an expression of fatigue, sadness, or harshness that does not necessarily match how they truly feel. And here is the interesting part. That does not mean that the expression is permanent. It means that it is the result of accumulated patterns, and every pattern can be modified when worked on consciously. Of course, the techniques we are performing help improve muscular mobility and tissue function, but there is also another aspect that deserves attention: postural awareness. Starting today, I want to propose a small challenge. Begin observing your face at different moments throughout the day, not to criticize yourself, simply to become aware. Most people discover something surprising. They keep their jaw muscles tense and the corners of their mouth slightly downturned, even when they believe they are relaxed. And when a posture is repeated hundreds or thousands of times every day, the body eventually adopts it as normal. That is why, in addition to the exercises, try to incorporate a new habit. Keep your tongue resting gently against the roof of your mouth and allow your lips to adopt a calm and relaxed expression. Some people describe this posture as the Mona Lisa smile, a subtle, serene, and natural expression. This is not about pretending to smile. It is about allowing the muscles to rest in a more balanced position. If you practice this for several weeks, there will come a point when it will no longer require conscious effort and will become part of your usual posture. And now let's finish the routine with the final exercise. In fact, this last step is especially important because it completes all the work we have done so far. Look at what we have accomplished up to this point. First, we released the muscles that were exerting a downward pull. Then, we improved tissue mobility and stimulated circulation. Now, it is time to work on the other side of the equation. We are going to strengthen the muscles whose function is to lift and support the face. The exercise focuses primarily on the zygomatic muscles and the cheek muscles, which are responsible for creating the natural volume of this area. When these muscles maintain good tone, they help keep the tissues of the midface elevated. However, when they lose strength over time, the cheeks tend to descend. The face may appear less defined, and a greater amount of tissue begins to shift toward the lower part of the face, promoting the appearance of marionette lines. That is why the goal of this exercise is to activate those lifting muscles in a controlled and efficient way. Let's do it step by step. Begin by gently bringing your lips together. Do not press them. Simply allow them to make contact. Now, try to smile very slightly, but focus the effort on lifting the cheekbones. Think of the energy of the movement as originating in the cheeks and not in the mouth. Next, place both hands on your cheeks. Your hands will act as gentle resistance. Push delicately downward with them while the muscles try to lift the cheekbones upward. This type of work is known as an isometric contraction, and it has a great advantage. It allows muscular strength to be developed without the need to perform large movements that could generate unnecessary tension in other areas. Before starting, remember two important details. First, keep the lips relaxed. They should not be pressed together during the exercise. Second, observe the area around the eyes. If you notice wrinkles beginning to form due to excessive effort, slightly reduce the intensity. Today we want to work the cheeks, not the eye area. Very good. Let's begin the first set of 15 repetitions. Focus on lifting the cheekbones. Maintain the resistance with your hands. Perfect. Now rest. Completely relax your lips. You can gently blow out to release any residual tension. Excellent. When you are ready, we will begin the second set. Same technique, same concentration, cheekbones upward, lips relaxed, and controlled movement. Perfect. Routine completed. If this video was helpful to you, share it with friends and family so they can also eliminate wrinkles and sagging around their mouth. Discover the 2-minute secret with Nivea and salt that eliminates hand wrinkles. Click here. See you in the next video.